Ask, Listen, Talk, Repeat. That's the new public awareness campaign aimed at giving parents and caregivers a chance to start a conversation on mental health with children and teens. Now, this is a partnership with Austin Public Health and Integral Care. We do want to remind you, if you or someone you know needs help, please reach out. The National Suicide Prevention Lifeline is 988. Again, if you need help, please call. Well, to give us insight on this new campaign is Michele Pierson with Integral Care. Michele, thank you, first of all, for being with us today.
Thank you for having me.
Okay, let's look at some data right now that we received from Integral Care. More than 1,700 children and youth received crisis support in 2022. Then in 2021, children and youth visited an emergency department more than 40,000 times with a mental, behavioral, or emotional issue. Even more concerning here, there has been a 65% increase in people taking their own lives. So, Michele, just looking at those numbers, what are some issues? You work in the schools, you work directly with the children. What are some issues you're seeing among children and teens that are leading to these numbers?
I think when we think about life in the post-pandemic world, we figure, things should be just going back to normal. But I think what we've seen certainly in the children and teens that we work with is that increased loss of structure and routine and increased isolation had long-term impacts on increased depression and anxiety. And so just the need for mental health support and increased support for children and teens is essential.
So we're launching this campaign in Central Texas. What solutions will this campaign offer to really tackle some of these issues and hopefully bring these numbers down?
I think one thing, we want to do is normalize mental wellness and mental health issues. It is a very common issue, and it's certainly mental wellness goes hand in hand with physical wellness. And so we want to make sure that those two things are connected. I think there can be a lot of isolation and stigma still attached to mental health issues. And so just being able to open the conversation between guardians, parents, and children and teens is a huge part of that. And that's where the Ask, Listen, Talk, Repeat campaign can really open that dialogue in families and even in schools.
Okay, and you really hit on a key point, a conversation. That's what needs to happen, a simple conversation. That's really the basis of this campaign and nurturing self-awareness early. What are some of the best practices for parents? How can parents do this to ensure that they're having that conversation with their children?
Certainly, I think as a parent and a parent myself, we shy away from those difficult conversations, particularly when we think we don't have the answers. And I think one thing to remember when we talk to kids, certainly about mental health, is we don't have to have all the answers. Just beginning to have a safe space for conversations is key and essential. And so really getting comfortable with some of these difficult to have conversations and introducing this idea that mental wellness is part of general overall wellness.
Okay, Michele Pierce, thank you so much for being with us.
Thank you so much for having me.